Rwanda has confirmed that it has noted at least 26 cases of Marburg virus disease, with 8 people reported to have died from the hemorrhagic fever.
It happened in the other outbreaks. This type of disease, most of the time, if not all the time, they start from hospitals. Because if you are sick, you go to a hospital anyway. And that explains why healthcare providers are the most at risk. And so far, more than 8% of the patients we have are actually healthcare workers or staff within those departments taking care of very sick patients.
Consequently, the World Health Organization has warned that the disease could spread to neighboring countries, as cases have been reported in districts bordering the Democratic Republic of Congo, Tanzania, and Uganda. According to the Ministry of Health, Uganda is on alert.
At all times we are working in preparedness, but when there is an event, most especially in the neighborhood, we transition from preparedness to readiness. And this requires us to do a couple of things that include activation of the response mechanisms to ensure that our readiness comes at par with what is existing.
Although guidelines for border points are yet to be issued, no travel restrictions will be imposed.
But as you know, under international health regulations, we ensure that whatever we do, we limit any disruptions on international trade and travel. So as such, we're moving to have screening at border points, and specifically looking out for individuals who may have symptoms. And of course, if they do, then we handle them accordingly.
This comes as Uganda is also dealing with an mpox outbreak. Uganda has experienced Marburg virus outbreaks in the past, including in Kwen district in 2017, Kampala in 2014, and Kabale in 2012, among others. According to the World Health Organization, Marburg is clinically similar to Ebola disease. It spreads through direct contact with body fluids, such as the blood of infected individuals, or through contaminated surfaces and materials like bedding and clothing, among others. The early stages of Marburg virus disease are difficult to distinguish from other diseases, such as malaria and other viral hemorrhagic fevers.
Marburg looks much like Ebola, and they come from the same family of viruses. So the presentation is much the same, but the literature shows that the case fatality or the case fatality for Marburg appears to be slightly lower than that of Ebola.
Symptoms begin abruptly with high fever and severe headache, followed by watery diarrhea, abdominal pain, nausea, and vomiting. In fetal cases, bleeding from multiple body areas often occurs, among other symptoms. Nobat at Kunda, NTV Tonight.